Why unverified is coming? You have to just register with your email. Your name will come. Very easy to join. Then it's like Zoom joining. If you are registered. गौरंग तेरा भी unverified आया है.
नहीं मैडम पता नहीं.
अच्छा पता नहीं. This is new WebEx. They have improvised it. Okay, Ashwini, hi.
Hello, ma'am. Hi. And Happy New Year to all.
Happy New Year to you,
Happy New Year,
Ashwini.
ma'am.
Thank you,
Happy
ma'am.
New Year.
Thank you. Thank you.
Yeah.
Thank you, ma'am.
So, can we start, madam?
Yes, we can start.
A request to all of you. Madam has already given you the time guideline. So, you have to restrict yourself for 8 minutes presentation and then 4 to 5 minutes of feedback. Is that okay with all of you? Otherwise, we won't be able to finish everybody's presentation.
There are 2 or
Yeah.
3 who are not here.
Not presenting today. Yeah.
Not presenting today. They are not here. 1 or 2 are not there also.
Not there. Not there.
So we can
Okay.
start. We can start.
Okay. Yeah.
Yeah.
So anybody can start.
Yeah. So Gaurang, should I allow them to share the screen? Yeah. 1 minute.
Yes,
huh?
yes, ma'am. Yeah,
Yeah.
you can share.
They can share, no? Okay. So Anand, Arun, can you start?
Ma'am, just come back from the office, ma'am. Just give me 10 minutes, ma'am. I'll be joining
Okay,
next.
then who is starting? Sandhya?
Yes, ma'am.
Are you sharing the screen and presenting?
1 second, ma'am. Yes, I will do it.
You have to, all of you, what I will request after this session is, you contact your guides and schedule an appointment for half an hour, 20 minutes. 20 minutes is enough for next week. So that it can be done very easily at your convenient time to both. So that your project really comes well and good.
Ma'am, are you able to see, ma'am, the presentation?
It's very small. I'm not able to see it clearly. Can everybody see, or it's only me?
No, ma'am, I'm able to see it.
Is it not very small?
No.
No, ma'am.
Okay.
So I've kept the title as, can I start, ma'am?
Yeah. Yeah, I also can see now.
I've kept the title as Postgraduate Education Environment in Government Dental College, Kottayam.
Huh.
Learning environment, as you all know, refers to the educational climate and academic culture pertaining to an institute. It is a complex and multifaceted phenomenon. It has got physical, social, cultural, emotional, and intellectual aspects. When we look into the literature, there is no broad consensus on the conceptual framework or an operational definition for the term learning environment. Both quantitative as well as qualitative approaches have been used to study the learning environment. Learning environment is important in providing high quality education that basically it is required for student satisfaction and achievement, academic success, general well-being, and progression of their intellectual and professional skills. Additionally, both medical and dental education studies agree that student feedback about their learning environment is essential and are a significant data source to inform the further development of educational practices, learning environment, and curriculum. The International Dental Education Working Group, they have outlined the major recommendations, like you have to give an importance to workload, staff-student relationship, constructive feedback, interactive learning approaches, extracurricular activities, counseling, psychological support, and infrastructure too. So these are the recommendations which they have given. A robust clinical education environment has been described as one in which good medicine is practiced, which has teaching and learning opportunities that are patient-focused, well-planned, reflective, and motivating, which values professional behavior. But when it comes to negativity, what happens is that they lack the clear objectives and direction, passive, poor clinical observation, little time for reflections, and the students are humiliated and even they are subjected to bullying. There is evidence that professional satisfaction and patient care improve in a learning environment where postgraduate students are encouraged, suitably supervised, and fostered. And we are all blessed to have mentors who can be helping us to do so. Conversely, a negative learning environment may be detrimental to trainees and team morale and potentially jeopardizing the multidisciplinary working relationship. These are generally, we can put the learning environment into two categories, that is the clinical and physical. Physical is basically the infrastructure, whereas clinical, I've already explained those parameters like comprehensive treatment planning, treatment, multidisciplinary treatment approaches, thesis, clinical research, etc. Now coming to the dental postgraduate student atmosphere, learning atmosphere, there is lack of studies, especially for PG. Undergraduate studies, lot of studies are there. Students, lot of studies have come out, but postgraduate studies, not much of articles are being found and no, there is a need for systematically explore this aspect. Based on last time's discussion, Madam and Sir had suggested to go with a questionnaire-based study. And based on that, I searched the literature and found out two questionnaires for taking my study further. One is the DREAM questionnaire and the second one is the FEAM questionnaire, that is a postgraduate hospital education environment measure. DREAM is the Dante Ready educational environment measure. When we look into the literature, FEAM is considered to be better suited for a postgraduate setup. And this was developed by Rofe, McAleer and Skinner. This is a 40-item inventory and it has got 3 levels of assessment. That is the level of autonomy. First one is the level of autonomy. Second one, they assess the quality of teaching. And the third is the assessing the social support. So this is the questionnaire 40. It has got 40 items. And we can use a 5-point Likert scale, strongly agree to strongly disagree. And the literature suggests that there is a FEAM score which can be used to understand the level of atmosphere or environment in the institute where the study is going to happen. Setting is postgraduate departments, all the postgraduate departments of GDC Kottayam, and PG students, what I thought is to take the 3 years, that is 21-22, 22-23 and 23-24 students. Thank you, ma'am.
Okay, I will suggest in the title, when you want to publish, you have to put it as Kottayam, Kerala, India.
Okay, ma'am.
Or you can think about it. Ashwini, am I right?
Yeah, because it's not her postgraduate or something where, you know, identity reveal is revelation. You need not hide your identity. So it's perfectly fine even if you
And
write
one very
India
good
and
aspect she took out is the social networking. That social networking, what you have taken out, please don't use any negative words like bullying or, they are being humiliated. No humiliation. No one can insult you unless you give permission. Remember that, all of you. If somebody says something, it's my mind which makes me monkey and tells that he told me, so I feel bad, I cry. We do that. But in a professional environment, you should be more stronger. So that is one. All the same, the frustration of a human being always comes out and he takes it on others. So what we need to think is, if you train the teachers for connecting with students with a strong intelligence, I will not, maybe we can call it emotional, but Ashwini will give an input. But as students also, same thing, and then make a question, it will really work. I think that Padiyar is doing the similar study, am I right? I'm not
I
sure.
think sir is doing on student support, madam.
Student support, that's okay. That's a different one. Yeah.
Sandhya, your project is really shaped up well. Now, my basic question is the fame or fame, however, I don't know how to pronounce that. That questionnaire is the mainstay of your project, right? Okay.
Yes, ma'am.
So, first question, is that questionnaire freely available? In a
Ma'am,
sense, are you allowed to use the questionnaire as it is in your setting?
Ma'am, I have not. I have got the questionnaire from different articles. So
No,
this
what I
screenshot.
suggest is to be on the safer side. Search for this particular questionnaire because
Yes, ma'am.
the concern here is sometimes the questionnaire is copyrighted. And then the author or whoever has built that questionnaire would allow it to use it in your setting only after permission.
Okay, ma'am.
So just find out if it's freely available on the internet, then it's perfectly fine. But sometimes they do say that you either take a permission or you need to purchase it.
Okay, ma'am.
That's one concern I have. And second question is, I believe this questionnaire is made by some foreigner.
Yes, ma'am.
Right? Which country it belonged to?
UK.
UK. Okay, fine. So the items which are there, the 40 items, have you gone through all the 40 items?
Yes, ma'am. What I got is through the screenshot only. I have seen it. All the 40 items have gone through, ma'am.
Yeah. All those 40 items, are they relevant in your setting in India?
Yes, ma'am.
Can you share it quickly if it's there in your mobile or in your computer?
1 second, ma'am.
But it's not readable.
Ma'am, can I read it aloud?
Yeah.
My workload in this residency is fine. First question is, my workload in this residency is fine. Second, I have contract of employment that provides information about hours of work. I have to perform inappropriate tasks. The third one. Fourth one, there is accurate unit specific written information available. Fifth one, my hours conform to the curriculum. Sixth, I work according to the fixed timetable. Seventh, I had an informative orientation program. Eighth, there are clear clinical protocols in this rotation. 9, the training in this rotation makes me feel ready for the next step. 10, I have the appropriate level of responsibility in this rotation. 11th, I have the opportunity to provide continuity of care. 12, I have opportunities to acquire appropriate skills in practical procedures. 13, my clinical teachers promote an atmosphere of mutual respect. 14, I feel part of...
Sandhya, it will take a lot of time if you
Yes,
go on
ma'am.
reading 40 items. But
Yes,
try and go through each item and see whether it's relevant in our setting.
It is
Now,
more
you
to
must have...
medical. It is more to medical.
Yes, ma'am. Yes, ma'am. This they have used more for medical. Pediatrics I have seen. Urology practice I have seen. Even psychiatry I have seen. Psychology they have used. but dental they have not used, ma'am.
So
I'm
you
not
have to make it specifically for dental, may not be 40 items, maybe less, and remove the other questions. One. Secondly, you can make your own also and validate it. Thirdly, I very strongly feel that the academic environment is also encompasses a huge issue. What point of you want to use in the academic environment? The extracurricular activities, the teaching, everything is there. I think from your study, I feel that you want to use the relationship, teacher-student relationship.
yes, basically
Madam,
that
what
is
I'm
what I
suggesting, that
Huh.
let her do on 5-6 students first on her department. So it's like a piloting. We will
Okay.
come to know it is relevant or not, students are able to understand or not, and they themselves will tell that, Madam, this is not relevant to us. ऐसा कुछ नहीं होता, तो इसमें हम क्या लिखें? So I think can we go for a piloting of on 5 students and then we can think of doing it.
You make the questionnaire, send it to me, and
Yes,
then
ma'am.
yeah, you share it with me, Gaurang and Chinmay and Ashwini, of course. You mark it to all 4 of us.
Okay, ma'am.
So there will
See,
be
and
good.
even if
Madam,
what
just
I
you
would
can
suggest,
share in the group only, so we all 4 will
yeah,
go through it.
Okay, okay. That's
and
also
and
your colleagues will
Sandhya,
give you.
even if you
Yes,
are
ma'am.
not able to give it or administer the questionnaire to your PGs, even if you restrict your project to development of a questionnaire for your setting, I think that's also sufficient.
Great project.
It would be a great project
All colleges can use.
because
Again,
most of
just
the
one
times
more
this foreign, bol.
Gaurang?
Yes, ma'am.
perspective regarding these questions.
Gaurang, you're not audible.
Gaurang, don't start the video. Okay, when he comes, we'll see. Many times the internet is weak where he is. Doesn't matter. But I think it's going to shape up very well. It's a very interesting topic for me because what in dental colleges you require to change the teacher-student environment and relationship. Yeah. So that part, if you first give the questionnaire in general, and then we will see 2-3 aspects can be included. I'm sure you cannot include everything.
Yes, ma'am.
A positive academic environment is basically made by humans.
Yes, ma'am.
Yeah. No amount of extra gadgets can make it positive. Okay.
Yes, ma'am.
Thank you.
And
I was saying,
yeah, yes,
Yes.
I was just saying that be
Gaurang,
careful
Gaurang, we can't hear you.
so the interpretation will be different.
Gaurang,
What?
we couldn't get you.
I'll put it on the group. I'll put it on the chat.
Yeah. And also when you're giving it to your postgraduates of different years, whenever you give that questionnaire, the responses what you get, think of comparing it, segregating it year-wise and think of comparing it. How the environment is perceived by a first-yearite who's newly joined the department and how it is perceived by second or even third-yearite when he's already spent 3 years in the department could be different. So when you get the response, you try and segregate them into year-wise, and then you can think of comparing them. Okay.
Yes, ma'am.
But for this
Yes.
particular fellowship, even if you restrict your project to development of a tool in the form of a questionnaire to find out the environment in the postgraduate dental postgraduates in your college, it's perfectly fine, I feel.
Okay, ma'am. Thank you.
In that case, Ashwini, she can even vet the questionnaires in her college first, and then she can give it to another 25, 30, 50 colleges so that she gets the response. Of course, it's not easy to get a consent from all the colleges because it's a very
Yes.
sensitive topic.
Yes.
Do it in Kerala and Karnataka around some colleges where you have friends and all.
Yes,
Ethics
ma'am.
committee also needs to pass it, right?
Yes, ma'am.
So this should become an international project. No? That's why you should think big and do it.
Yes, ma'am.
Meenakshi.
But again, a word of caution, when you're giving it pan-India to different dental colleges, you are not aware of how the environment in the other college is.
Yes,
So
ma'am.
interpretation of the answers would be a bit difficult for you unless you have co-investigators in the college's
Different
way of
areas,
giving the
colleges.
questionnaire.
Then
So
in
just
that
a
case,
word
you
of
take
caution.
your college all postgraduates, not only post.
Yes, that is more advisable. Go
Yeah,
for
but I'll tell
all
you, Ashwini,
postgraduates
one
of
thing.
your college.
Ashwini, one thing, it is requirement of the day in dental colleges. Multiple reasons are making people behave that way. So I thought the problem and the issue is the same everywhere.
Acha. Maybe
Because
then you
yeah.
know better
So
the
let her
dental.
do it with all the postgraduate. If it becomes proper, then we will tell her to go in state-wise or
First
few states of
first to
this,
develop the tool, give it in your college, see what kind of responses you get, and then to expand the project, you can think of giving it the other colleges as
and
well.
secondly, hers a government college. Government college students
Government
are
and private is
intelligent
different.
and the staff are well paid. So the atmosphere will be much
Different.
better.
Yes, ma'am.
So
It
I
will be
think
different.
you restrict it. Yeah. Okay, Meenakshi.
Yes, ma'am. Yes, ma'am. Ma'am, you're able to see my slides, ma'am?
Yes.
Okay, ma'am.
Make it full screen, please.
Yes, ma'am. Yes, ma'am. Ma'am, the topic has been discussed and with Suhasini ma'am and Chinmay sir also as ma'am, and the title has been changed again with the earlier what it was in the earlier presentation. So the title of my project is Need Assessment on Knowledge and Understanding of Dental Students on Diet or Nutrition Counseling for Geriatric Denture Wearers. Why is this intervention needed? The relationship between oral health and nutrition is no different, and I think all of us are well aware that oral health is no different than systemic health. But the influence of prosthetic restorations on nutritional status has been previously seen, but particularly concerning the complete and removable partial dental prosthesis. But the major lacking lies that there is lack of awareness on dietary counseling rendered by undergraduate students involved in the fabrication of complete dentures for geriatric denture wearers. And hence, this is the problem. The prosthetic therapy may be necessary to maintain or restore the masticative function in patients with partial or full tooth loss. Many additional factors also may play a role to condition the older people. As a result, many age-related medical disorders are also seen together with the, just a second. So together with the new nutritional components as well, and hence there is a need of the dental team to be more aware of these potential negative effects of the dental treatment, and in the same fashion to provide nutritional counseling to counteract these negative effects. So as age increases, the chance of losing teeth is also more common. And because mastication is the initial step in the digestion process, and masticatory function often leads to decreased food absorption efficiency, especially in our geriatric denture wearers, and which in turn affects the nutritional status per se. In addition to masticatory disability, various factors have also been implicated in the pathogenesis, which includes the anorexia in the elderly, and together with gastrointestinal function decline and depression, which also may lead to reduced nutrition intake, which can exacerbate poor nutrition status. This poor nutrition status may cause various diseases, particularly the lack of protein intake, which leads to decrease in the quality of muscle, which we commonly seen in our elderly geriatric population. And hence the outcomes has been enlisted here as short-term, intermediate, and long-term outcomes, which has been discussed with ma'am and sir. So these are my short-term outcomes. By imparting the knowledge regarding the nutrition or how the dietary counseling has to be imparted by undergraduate students will improve the students' knowledge on nutritional counseling. And also the students are more confident when attending to their patients. The compliance of the patients also gets increased. Students are more confident in interpretation of clinical situations and at the same time to give the nutritional counseling to their patients. And students will also be satisfied with this kind of programs. The intermediate outcome being the development of satisfactory dentist-patient relationship. The students perform better in all their clinical postings and a better student-faculty relation. Long-term outcome is in the integration of nutrition counseling in the dental curriculum, which can lead to increased pass percentage of students with better results. They'll be more confident, and improved patient care by trained graduates and in their professional life. So what were the major gaps and limitations? Dietary intervention has been benefited patients with conventional complete dentures or implant-supported mandibular overdentures. Individuals with fewer posterior teeth and those with no replacement of their missing teeth are at higher risk of for poor nutrition. And hence, there is a need of the hour of nutritional assessments, dietary counseling, and follow-up, which should be made mandatory as a part of undergraduate clinical training with the development of standard protocol for the same. So there have been few interventions and few results which I have come across in during my literature search. That was one of the studies where the nutrition was imparted. There was diet and nutrition to general health. So that was a study which was done in one of these colleges. The another study was done in dental institution in Kerala, where postgraduate students had better knowledge when compared to undergraduate students regarding nutritional counseling. And hence, to the best of our knowledge, there was only one study which has been explored, the difference in the level of dental nutrition. Geriatric nutrition per se, there are no studies where the undergraduate knowledge has been assessed. So how is my project different when compared to the other projects? Is dietary questions can be incorporated in the medical history itself when they're taking the case history diagnosis and treatment planning, which can enhance their the compliance between the patient and the dentist. So during the first appointment itself, they'll get to know what exactly they'll have to guide the patient when they give their dentures at the end of their treatment. So regular nutritional counseling sessions for optimal oral health can also be a part of their curriculum, and early identification of malnourished elderly patients will also be helpful, which can help them in guiding their patients to dietary counseling or nutrition or to a nutritionist. And hence regular dietary assessments within a week of placement of dental prosthesis and every 3 to 6 months provides oral health care professionals opportunities to educate their patients with tailor-made recommendations to optimize their dietary choices. So this is my concept map. So the end would be the improved patient care by trained undergraduates would be my long-term goal. So these are my outcomes. Yes, ma'am.
The previous slide. Can you read the concept map, the row-wise, because I can't read it all.
Okay, ma'am. So the short-term outcome would be increased awareness for the need of diet and nutrition advice by the undergraduate students, which in turn, so profession-specific nutritional competency for complete denture wearers, the students will be more aware of, and hence the students could perform better in their clinical postings, and in turn, which can increase there is increase in student confidence. This in turn will help have a nutrition education by our team itself. So better interpretation of clinical scenario on nutrition related risk factors, better patient-student relationship. The student-faculty interaction will also increase, and there is increase in pass percentage at the end. If at all, if the student is performing better in their final year exams, so there is increase in pass percentage because the end, how they are going to communicate with their patients is also looked into. So their clinical skill is also increased. There is more scope for correct diagnosis and treatment planning with giving their artificial substitutes to their patients. And with this, there is also increase in patient input when it comes to college per se, and hence there is increased visibility of the institution, which in turn will culminate in improving the patient care by trained undergraduates. Shall I proceed, ma'am?
Yes.
Okay. So these are my outcomes, my indicators, and the data source. So the questionnaire will be a self-administered questionnaire. And so this is my indicators, ma'am, indicator matrix, which I've already shared with the ma'am and sir.
When you say students are more confident when attending to patient, you're comparing that more with what? Your pre and post data?
Pre and post, yes, ma'am, pre and post.
Yeah. So can you also need to share the questionnaire? Huh?
Yeah, ma'am, I'll be sharing it right now, ma'am. So my methodology would be a cross-sectional survey which will be conducted among final years and interns. The final years, because they are more aware of how to give the fabrication of dentures and how they have to establish the rapport between the patient and the dentist. And hence my sample population would be my final years and interns, which is a purposive sampling. And it is a self-administered questionnaire which includes 42 questions, knowledge component of 28 questions. And I'm unable to see this. Just a second, ma'am. I just drag this panel so that I'll be able to see. Yes, ma'am. So attitude, 10 questions, and what could be the main barriers for them? So I have administered 4 questions. So these questions will be divided into 4 parts. Their demographics, knowledge, attitude, and barriers. The correct response will be scored as 1 and the incorrect as 0. So this questionnaire will be circulated among the final year undergraduate and interns through Google Forms after the approval from ethics committee. So it's a cross-sectional survey. So my ethics committee is mainly due for March, ma'am. So hence I've kept for April to May. A convenient sampling of 127 dental students will be selected. Right now, the batch will be 46 final year students and interns 81, a batch of 2020 to 2023. So all these are the inclusion and exclusion criteria. The response to the question will be considered as implicit consent with no signing off for a written informed consent, and ethical approval will be taken from the institutional review board.
Will the ethics committee pass that implicit?
Yes, ma'am. Yes, ma'am.
Yeah.
We will also be taking the consent from the students, but if at all, if ethics committee questions that I need to take, I will be taking the consent, ma'am.
Because it's always better to write before the questionnaire a pre-basic. See why the dentures are given. Basically for aesthetics, I think basically it's for the eating also.
Yes, ma'am.
So what do they eat, how they eat, and what type of food they eat, whether it improves the. So in your lecture also, please include these aspects. Asking them the questions.
Yes,
and so this will, you will also have to find that the patients have no complaints about the dentures. If they have denture complaints, they will remove it.
Correct, ma'am.
You will get a false data.
Yes, ma'am. Yes, ma'am.
Yeah. Yes. Ashwini?
No, she's yet to finish the presentation, right?
Yes, ma'am. I'll finish, ma'am.
Go ahead. Go ahead.
So the data quality assurance, the collected data will be checked regularly for clarity, competence, and consistency, and reliability and validity. And the necessary changes will be made on the questionnaire that needs correction, and invalid questionnaires will be removed before the actual data collection. So this questionnaire was actually circulated among 5 nutritionists, ma'am, and I've already taken their feedback, and I will be projecting the questionnaire as well. So the data will be analyzed with SPSS version 2022, where descriptive statistics will be used, and the chi-square test will be used to find the association between the variables with the p-value of less than 0.05% will be considered as statistically significant. The content validity will be established by a panel of 5 nutrition experts, which has been done by the Department of Nutrition Sciences from the Faculty of Life Sciences, JSSCHER. So the item difficulty analysis, so the previous literature has documented those questions which are answered correctly by more than 80%, or less than 20% of participants are considered easy and difficult questions respectively, and hence the same thing will be implicated even for my questionnaire as well. So reliability, Gaurang alpha will be taken, and it will be a measure where internal consistency or the extent to which a group of items measure the same construct. Hence, Gaurang alpha of more than 0.7% will be considered as acceptable for a measurement scale. So this is the flow chart. I've done the literature survey for dietary requirements for geriatric denture wearers, the knowledge, attitude, and barriers among the dental students. The item generation, wording, comprehension, readability was done. Incorporation into a 42 item questionnaire, content validity by 5 nutrition experts, to put it in a nutshell. So this is my Gantt chart where the planning was done in Jan and Feb, which will be continuing further for my ethical clearance, which is scheduled for March. My questionnaire preparation validation has already been kick-started from December itself, but I will be continuing for Jan if I'm getting some inputs from my higher-ups and my mentors, Ashwini ma'am also. So ethical committee is scheduled in the month of March, ma'am, where I will be applying for ethical. And if at all, if I get any queries from them, then I'll be keeping that for standardization. My administration will be done in the month of May for the students before their final year exams. The data analysis, data reporting will be done in June and July, and the project submission will be done in the month of August before we could complete our project for the presentation in the October. So this is my questionnaire, ma'am. So the what has been marked in red was what they have suggested to recorrect the sentences so that it will be easy for the students to understand regarding the knowledge.
Can't read the questionnaire.
Not, ma'am, shall I share it in WhatsApp, ma'am, right now? I will just share it, ma'am. Ma'am, I will just tell you quickly. 1 to 14, 1 to 13 is only yes or no questions, whether they are aware of and whether they are giving nutritional counseling to their patients and how often are they giving. And if at all, if they have a patient with systemic illness, are they inquiring that what kind of nutrition or diet they are following? And if not, are they referring it to a nutritionist or a dietitian? From 16 is the recommended dietary allowance as per ICMR 2002. What are the required dietary allowance for geriatric patients? So are they well aware of how much should be the protein intake, the vitamin C intake, are they aware of? Because their syllabus already have the nutrition in the second years and third year syllabus, but are they following, are they well aware that they have to include that parameter also when they're giving the dentures also? So hence I've included whether they are aware of how much protein intake, or for older geriatric patients, how much would be the correct intake? Are they aware of the correct dosages? From my on the knowledge on diet recommendations for denture wearers. So during the first post-insertion day, how are they advising? What could be the vegetable, if at all, if the patient is a vegetarian or a non-vegetarian, so what are the criteria? So I'm combining all these in a Google form so that it is easy for them to just put a tick. So during the first post-insertion day, during the second post-insertion day, how exactly are they going to give the instructions to the patient? So that would be the second and final post-insertion day, ma'am. And attitude component, are they maintaining the dental and general health? That do they really know that maintaining of dental and general health is required for the adequate diet? Dental curriculum should include a strong emphasis on nutrition and diet guidances. Are they aware of it? Is it imperative to integrate nutrition guidance into a standard dental practice? And when providing nutrition instructions, dentist might generate the guidance. Should they require a guidance from a qualified dietitian or nutritionist? Do they agree with it? And patient who develop physical indicators on malnutrition, do they refer to their dietitian or physician? For that, are they aware of? And keeping one's mouth healthy is a personal responsibility. Do they really agree? Ensuring the health of the oral cavity and dentures are essential. Do they agree? Dietary advice works well with dental settings. I feel competent to offer dietary advice. Dietitian, nutritionists, and public health professions are responsible for providing diet counseling. So, do they really agree, or should we also be a part of nutritional counseling? So that was the attitude component which I've included. Together, I also wanted to know whether there are any obstacles which they have come across for nutritional counseling. Diet counseling is time constrained, lack of confidence when providing patient counseling. Dietary guidance is limited by patient compliance per se. Dietary counseling is limited by reimbursement. That means, if at all, if they direct to a dietitian or nutritionist, will the nutritionist give the correct counseling for the patients? So are they aware of such kind of barriers? So just wanted to know with my questionnaire.
Now, will you have an economic strata of the patient? Accordingly, the diet can be given, because
Yes, ma'am.
Yeah.
Yes, ma'am. So ours come in our Mysore population, probably most of them will be both a mixed kind of diet only. So hence I've included both vegetarian and non-vegetarian.
I'm not talking of that. See, we are talking sitting here in a, with our computers. In the ground reality is that many denture patients, elderly, can't afford. So we have to have the counseling done so that the food is local, at the same time it is available easily and economically.
Correct, ma'am. Right, ma'am.
I can give them cheese and butter and quinoa and avocados. Will they afford it? Yeah.
Ma'am, actually that is the reason why I have categorized it as vegetable, fruit group, bread and cereal group. If at all, if our patients are not eating all that, are they more into wheat or ragi or with milk? Because ours are more into our Mysore population are more into ragi, wheat, and a little bit of rice. So hence I've included those as well. This I got it from one of the questionnaire only, ma'am. So hence it was easy for me to incorporate this into the.
Meenakshi, again, a very good project.
Thank you, ma'am.
First of all, you would need consent of all the students.
Yes.
Because this is a questionnaire and students are vulnerable population. So when you go for publication, it is better to have ERB and consent. That's one thing. Second thing is, you have shown this questionnaire to nutritionists, right?
Yes, ma'am. Yes, ma'am.
Yeah. So who are your stakeholders in your project? They are third or fourth year students and interns.
Yes,
right? Okay. So you need to show this questionnaire to at least few of the interns and fourth year students with the idea about not actually marking the correct answer. The idea is what you want to ask them, whether it's the same thing they are perceiving.
Okay, ma'am. Done, ma'am.
Whether the meaning is the same.
Convey.
Otherwise,
Yes.
that would be a problem. And
Okay,
those
ma'am.
students, you don't include them in your final project.
Done, ma'am.
Okay,
Yes.
you need to exclude them because they've already been
Yes.
exposed to the questionnaire. So,
Right.
so you understand why you need to show
Done,
it
ma'am.
to the few of the students from intern and the 4th year. Okay,
Yes, ma'am.
so that
Ashwini,
is
she
one.
can give it to us also in the 10, 12 of us in the group because
She
we are.
can give, but again, who's going to actually answer the questionnaire is the
Yes,
students.
yes, yes, yes.
If she's asking ABC, and if the student interprets as XYZ, then that would be a problem. Okay, so you
Done.
literally would have to sit with that student and say that, okay, this is the question. What do you mean? What do you understand by this question? If
Done.
whatever he tells you is what you wanted to ask, go ahead.
Okay, ma'am.
Okay, it's like that. You would
Yes,
not
ma'am.
evaluate it anywhere. It's the
Sure.
kind of validation you do it with the
Validation.
stakeholders. Okay.
Done, ma'am. Yes, ma'am.
One more thing I want. You also mentioned in your presentation that you would be giving this questionnaire just before their exams. Am I correct?
Yes, ma'am. Yes, ma'am.
Yeah. So just a word of caution, it's a big questionnaire. They may not have time or they may not
Right.
be in the mood to answer your questionnaire. So
Done, ma'am.
think whether you can give it way before your
Prior.
exams
Oh,
or
okay, ma'am.
after their exams, when they have
Okay.
time and their mind is free.
Free.
Yeah.
Okay.
Okay.
Done, ma'am.
And before the exam, again, there would be some ethical consideration because you are their madam and you are asking them to fill the questionnaire. They'll just fill it for the heck of it without
Okay.
actually putting any brains to it.
They have
Done,
two
ma'am.
Okay. So,
postings, one in the first semester, one in the second semester. So you
so
consider
just think of timings when you want to
Done, ma'am.
administer the questionnaire. Okay.
Ma'am, actually, our
Otherwise,
ethical
it
is
looks good.
ethical is in March, ma'am. So as soon as I get the ethical and they're okay with the questionnaire, maybe I can administer in April. With your
Correct.
permission, I will inform, and then if you're okay with it, then I will administer and I will get the responses immediately, ma'am.
Correct.
So that they will be
Correct.
fresh and they will be able to.
Yeah, yeah.
Correct. Correct. Yeah. Okay.
Thank you so much, ma'am. Thank you, ma'am.
Shilpa, Shilpa, Mirna.
Good evening,
Hello.
ma'am. Ma'am,
Yes,
I'll
ma'am.
take little bit time, ma'am. Mine is not
Good
clear.
evening.
Before we start discussing of Dr. Meenakshi, just I would like to suggest that she has also shared questionnaire, and I feel that there are some structural changes may be required to make it
Okay.
more of educational research rather than a research of medical or nutrition.
Okay, sir.
Yeah.
So anything which you would like me to eliminate or something like that, sir?
That later after.
I think I will share with you. You
Yeah.
already
Okay,
shared with me. I will share with you.
Done, sir. Done, sir. Yes. Thank you, sir.
Shilpa is there or not? Okay, then who is there? Jyoti? I think everybody is muted and gone away. Shilpa? I saw
Ma'am,
her myself.
I just give her a call, ma'am.
Arun,
Yes, ma'am.
are you ready?
Ma'am, there is a little bit problem in connecting, ma'am. I'll just connect it.
Okay, you're connecting, Mirna? You spoke, no? Or Shilpa spoke?
Ma'am, mine is present in a haphazard manner. I can present it, but it is not well organized like Dr. Meenakshi, because I have written in a Word file, then I am organizing into. If you want me, I can present it. It is present in a tentative format. It is not fully organized like Dr. Meenakshi. If nobody is
Yeah, you can-
presenting, then I can go ahead.
No, you can share it. You can share it. Ashwini, she requires a hand holding. So let her present whatever she has, because last time we only gave her an idea. So this time let her do it. So she's ready next time. Yeah.
Ma'am, just a minute.
Shilpa, please be ready. Join with your mobile hotspot otherwise.
Yes, ma'am. Yes, ma'am.
Yeah.
Ma'am, just few minutes, ma'am. Just few minutes.
Who
Let
is
me
ready
copy
then?
this.
Who is ready? Nobody is ready. You have presented. Anand is not presenting. Jyoti, Shilpa, and Arun, and Mirna.
I'm presenting.
Okay, Tukar.
Can you see this screen?
No. Share the screen.
Once Dr. Mirna present, I think Dr. Jyoti, you also present, so we can just have opinion of others also, and then we will modify accordingly.
This is Arun, I think.
Yes. Once Arun
Yes,
complete, then Jyoti can also present whatever you submitted to me with the topic in mind. So we can further discuss based on the input from Dr. Asmi, Dr. Nagda. Dr. Arun, go ahead.
Respected mentors, my topic which I've chosen and what I initially.
It's not audible.
Ma'am,
Is it audible to all?
No. It's not audible. It's not.
Ma'am, can you hear me now?
Yeah.
Again, it's not audible.
Hello.
Yes, you are audible now, but often you are not audible.
Ma'am, I'll take 5 minutes, ma'am, and re-log in a different computer.
Okay, in that meanwhile, I'll ask Jyoti to present. Jyoti, you please stop sharing. I don't know whether Jyoti is there. She's not even answering.
Ma'am, let me try myself.
Okay, you try. I think the network problem is there for everybody. Why? This is who? Mirna.
Yes, ma'am. You was
Make it full screen, please. On that red band, that yeah. No, this is not full screen. Full screen is that cup, what you give for price. It's there on the right side on the red, where you can increase the ratio. That one. Take it down on the right side, please. Take it down.
Slideshow is there, no, ma'am? You can use the slideshow and from beginning. Slideshow.
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 From yeah, that also can be. Yeah.
Slideshow.
Yeah.
Ma'am, it is present in a very crude format, yet still then I am presenting it.
Yeah.
Okay. Good evening, my mentors. I have tentatively selected a topic. My name of my topic is Mini Clinical Evaluation Exercise, or DOPS, a direct observation of the procedure assessment for postgraduate resident in the Department of Prosthodontics. I have kept two assessment methods as an alternative method. Actually, initially I have chosen to take both the methods, but as per suggestion of ma'am, either I will be taking the mini sets or the DOPS method. Now, what is the background? Formative assessments of the procedural skill like mini clinical evaluation exercises or DOPS are not conducted conventionally in the prosthodontic department. They help to find the gaps in the performance and provide a structured feedback to the student. This will ensure to improve the competency of the postgraduate training. Now, if I'll introduce the mini clinical exercise. Mini clinical exercise is a new assessment tool. That helps the student in using a standard help to assess the student using a standard rating form. The aim of this study was to evaluate the feasibility and usefulness of the mini steps as an assessment and feedback tool in the postgraduate setting in the prosthodontic department. If I am taking the mini steps as an assessment tool, if I'll proceed to the other one. That is the direct observation procedural skills or DOPS. It is a workplace-based assessment tool on real patients. The trainee carrying out the specific clinical procedure within a particular clinical setting is being observed by a trainer. Feedback is being given by the trainee, given to the trainee to assist them in developing and improving their skills. Now, ma'am has asked me two questions. What is the difference between the mini sets and the DOP procedure? What I have found is that in case of the DOPS, the assessor usually assesses directly while the trainee is conducting the clinical procedure. But in case of the mini sets, they are inquiring about basically regarding the patient history taking, general examinations, and not regarding any specific clinical procedure that is being carried out in the mini sets assessment system. And moreover, mini sets assessment system was found to be a crossover type of the study, cross-sectional type of the study, whereas DOPS was, it was given that DOPS is a longitudinal type of the study. That is, we have to assess the PG students after an interval frequently. They have taken an interval of 4 times minimum I have seen, and maximum.
If I can interrupt you, Mirna,
yes,
even mini CX is not cross-sectional.
Okay,
Okay, mini CX also, the encounters should happen at least 6 to 8 encounters in a year with different assessors.
Okay,
is mini CX.
Okay,
One encounter will not give any perspective to the trainee.
Okay,
So both are almost the same, where DOPS, the procedure is being observed, while mini CX is the examination, which starts from history taking up to the examination, diagnosis and treatment of the patient, at least in medical side.
And DOPS also has a checklist, and DOPS also has a rubrics, wherein the marking, the whole thing is to give a objectivity. She has made a real good attempt, Ashwini, I must say, because these topics are new to them. She made all the attempt to find out, talk to her people in the college. They're all ready, really appreciate.
Ma'am, DOP, what I have found, DOP or mini sets, is it possible, ma'am? Because if I am observing a student first time, then the same assessor needs to assess the student all the 4 times, and this will be again repeated with all the assessors? Or
yeah,
suppose
if you are doing a study, yes.
Suppose PG student number 1 is being assessed by assessor number 1, that will be for the 6 times. Then assessor number 2 with the same PG student will be again for the 6th time. It is like that. Or one PG student assessed by 6 faculty, that will be considered.
You are talking about
required to create a proper examiner variations we want to know. So if there are 4 examiners, all the 4 are marking. You want to see whether the objectivity has come here or there is a lot of subjectivity. Last year, one student has done this on fixed partial tooth preparation.
My doubt is, suppose if a PG student number 1 is to be assessed 6 times, all the 6 times has to be done by a single assessor. In that way, all the
4 assessors will see all the time. And
no, it's one assessor at one time. It's one assessor at one time.
One assessor at one time, but to see the examiner variation.
DOPS, objective of DOPS is not to see the inter-rater variability.
Okay.
Objective of DOPS is it's a workplace-based assessment tool where you actually see how the trainee performs in the actual workplace.
So in that case, she needs to have a 360 degrees?
No, not needed. DOPS has its own checklist So
Yeah.
say for example, I am not from your field, but say for example, suppose your trainee wants to show you the technique of root canal. Okay. So then when he's doing the root canal, you as assessor are observing him with a checklist in your hand. He continues to do the procedure, but at whichever point you feel that the technique is not being followed correctly and it is going to have a bad effect on your patient, assessor chips in.
Okay.
You stop the trainee then and there and you give the immediate feedback to the trainee that this is not the way you do it, this is the way you do it.
Okay. So whatever I
Okay.
have suggested, ma'am, whether that student has improved that thing or not is to be checked by a assessor number 2.
You
Like,
can either if that procedure is standardized procedure wherein there are no variations or there are no assessor differences, then the same assessor can assess the trainee second time to see whether there was any improvement as compared to the first time. But if there are going to be, like for example, in mini CX, there are going to be different, like I treat a patient in a particular fashion, I may think differently than my colleague. The treatment would yet remain the same, but my thinking could be different. So that is all the trainee is exposed to. But with DOPS, what you can do is you can select 2 or 3 procedures from your specialties, which are the must procedure, which your postgraduate has to know. And then you can involve your colleagues. All of you can sit and once decide that ABC, XYZ, this is how the procedure is going to be. So all of you are on one page. And then you take your students or your trainees, and then each one of you can, if there are two or three trainees, whatever it is, then each one of you can individually go to 2 or 3 trainees, one and one assessor. Trainee does that procedure, and then you give the feedback. But again, remember, DOPS is not used as aisa nahi ki your postgraduate is joined today. He doesn't know ABC of root canal and he started doing root canal and you are doing DOPS. It doesn't happen that way. He has to learn doing root canals. Okay, I'm taking example of root canal because I don't know any other, I'm not very well versed with any other procedure, but he has to, this is not the initial teaching part where you chip in and you take DOPS.
okay.
When he's learned about the root canal procedure, then you can come in and then you can have DOPS. And then he can demonstrate and you observe.
Ma'am, one more doubt. Suppose I have taken into account only one treatment procedure. So
Okay.
you are telling me that in the mini sex I have found they have taken into account 8 characters. 8
Okay.
parameters they have taken, 8 treatment options they have taken, because they are simply observing the patient. Okay. But in my case, I have actually taken a clinical procedure that the student
Okay.
will be conducting. So
Okay.
ma'am suggested me that you focus on only one parameter, one clinical procedure, not on multiple
Okay.
clinical parameter.
No,
Then
not
my doubt
necessary.
is that
Now that we are doing only with one examiner, one particular procedure, if you are taking 3 or 4 things, I think Ashwini, she can involve 3 or 4 faculty and 3 or
Yes.
4 procedure. See, last time
Yes.
in the mini CX itself, that inter-rater variability and all those things was seen, or maybe more than inter-rater variability. Ashwini, Medha did that. All the 6 examiners, they were trained in looking at in the mini CEX. She included, like in prosthodontics, we have them perform a impression procedure, maybe a jaw relation, or maybe a tooth arrangement balanced, or maybe tooth preparation in fixed, or designing a partial denture, whichever she takes. We all have 3-4 steps or maybe even more.
So
she
ma'am,
can-
each step, so I can do that if I have to assess a student 5 times or 6 times. So I can segregate that. Suppose I am observing the impression wala part, and one of my colleague will be observing the jaw relation part. So jaw relationship, that person will be observing for 6 times, all the PG students. And if I am taking into account the impression part, I will be observing the impression part of all the PG student, all the 6 times.
We'll have to think about it. Because I thought the same patient,
Have you done the literature search, Pinna? Is DOPS done by any of the dental? Is there published paper where DOPS is used in dental?
Yes,
So
yes.
go through those papers and see what is their approach. How have they done it? It may not be prostho. It could be other specialty in dentistry. That's
DOPS are
perfectly
very
fine.
widely used in all the colleges abroad.
So just see how have they gone? Have they taken one procedure? And because it's not, you have to understand it's not a first time teaching. How do I put it?
It's not a novice. It's not a
It's
novice.
not that ki ek baar kiya, mistakes hua, then again second time kiya, third time kiya. ऐसा बार mistake होता है, तो that means there's some gadbad with the initial teaching of that student. He has to get first trained in that procedure and then see whether he's doing it properly or not.
Ma'am, you kindly suggest me that actually what I'm getting confused that should I focus on only one clinical treatment for the beginning? Then once it is successful, I can go ahead.
That's what I'm saying.
Come immediately.
Go through the literature.
Go through the literature, note down, and take a month. You have lot of time to do it, but keep doing that and see. All literature collection is quite a bit in DOPS in dental also, because all our procedures are observing, but we don't observe them directly. We are asking them to come and show us that is wrong. Asking them to looking at them after the tooth preparation. So what Medha did was how the tooth preparation, the history is taken, how they preparing the tooth, the finishing lines, and everything she considered. And she did only one procedure, but 4 steps in the one procedure. And because to increase the number of for the statistics, she had 4 or 5 faculty members observing the same thing.
Yes, ma'am. Ma'am, I am also telling the same thing that there is one doubt. Suppose I have in my college 9 PG students are there, and I have talked to 6 of the faculty, and they all are interested to cooperate with me.
9 PG students across the 3 years?
No, 9 total. First 3 PG student per batch.
That's what I'm across the years means first, second, third.
Yes,
as it is, Ashwini told you, you cannot take the novice. Novice is the just entered students.
Ma'am, but what the topic I am taking, impression making in complete denture, that is done from the first year itself. No? I am not taking any advanced procedure into account.
But if apart from impression making, primary impression,
yes,
you can take 1 or 2 more procedures, she says.
Jaw relation, I will take completely the complete
all the 5
part.
steps. You can take all the 5 steps. You can take partial denture also, because designing is a big thing for these guys. We don't observe it. We just pass it.
Okay, ma'am. Okay.
You are on the right track. Take complete denture. Take the 5 steps, or take 3 steps.
No, I can take the complete denture. That will be easier for me. Ma'am, just one more doubt.
Mirna, just a simple question.
Okay.
A student is in your department and is getting trained in a procedure ABC.
Yes, ma'am.
Right?
Yes, ma'am.
How do you assess at present that student with regards to that particular procedure at present? How are you doing it?
Just by just seeing them and telling them verbally that these things are wrong.
When the whole procedure is over, they see.
Then at that point of time, when you are taking that assessment should be DOPS.
And what criteria I am telling that your whatever procedure you have done is wrong or right?
No, that's what I'm saying. So then student आपके यहाँ कुछ लेके आता होगा ना, that this is the denture I have made, right?
Yes,
and then you must be saying, "Arey, this is wrong, this is wrong, this is wrong, that is wrong," whatever, right? So how do you assess? After he has gone through the learning phase, when he actually gets a denture to you, instead of that, you tell him that today you're going to make whatever, you do that procedure in front of me. And when he's doing it, you be there, you observe, you have a checklist, and you give him feedback.
Yes, ma'am. That part I got. Whenever we are giving a
set of competency, this is not for learning. This is assessment.
Yes, ma'am. Ma'am, I'm just telling to Asuni ma'am that a complete denture, whenever we are giving to a patient, it involves 5 to 6 steps. So Nagda ma'am and me were discussing that should I take only one step of the complete denture, or I should take all the 5 steps, allotted it to different.
It depends on you. It depends on you. It is totally up to you. How many procedures you want to assess using DOPS is totally up to you. It depends on how much time you have, how many PGs there are, what is the faculty position in your department. It all depends on that. It boils down to the feasibility issue rather than anything
And
else. You can concentrate on one procedure, or you can concentrate on more than 2 procedures or more than one procedure. It is up to you.
And also remember, if you take all the 5 steps in the jaw relation, balancing, and all those things, steps, no ventriculation, confirming, that itself has 4-5 steps, Mirna. So decide, you have a full freedom to decide how much you want to do. Probably primary is more easier.
Yes, ma'am.
But the jaw relation part has 3 or 4 steps. It's not only tentative jaw relation, it's confirming the jaw, whichever method you use. Gaussikas is not the only method. There are so many methods. Whatever method you are using, then you are mounting on the articulator. There are 4 things you are also creating the balance, and how you adjust the articulator is also thing. So 4 or 5 steps comes in that itself.
Okay. And a single assessor will be observing all the steps likewise. So it will create the multiple number of times, no, ma'am. 9 PG, 6 faculty means 54
Mirna,
times.
Okay.
Mirna, listen one thing. Before you stick to anything, I suggest please do literature search. See what the others have done with regards to the methodology, and see what is feasible in your context, and you go ahead and do it.
Okay, ma'am.
Yeah, that is
Okay?
better.
You as a researcher, you have full freedom to do it as long as you do it correctly and you have some rationale behind it. And please decide whether you want to go for mini CX or DOPS before you start doing the literature search.
Mirna, you take 8 to 10 days to do this. I'm not in a hurry, but do it in a proper manner. Okay?
Okay, ma'am. Should I take mini sex or should I take DOPS, ma'am?
That's
Because
what
in
It
Ashwin
is up to
telling
you. It
to
is
you.
up to you.
Yesterday I told you the same thing.
Mirna, listen one thing. Everything, it's this project is for you guys to learn things, to learn how to do educational project. So if you're going to absolutely follow what Nagda madam or your other co-guides are going to tell you, then you don't learn anything out of it.
yes,
You are
ma'am.
getting it? I'm
Yes.
a bit strict out here, but then that's what, even if you make mistakes, it is perfectly fine. But you have to come up with a plan and then ask and take advice. You don't follow what your seniors or what Nagda madam tells you to do.
Okay, ma'am. Ma'am, in the mini sex, whatever literature I have studied, they have told about, they have assessed regarding the patient's history taking, general examination, and how they have handled the patient, their behavior with the patient, and all those things. All these things are present in the mini sex. They have taken in a very bird's eye view manner, not in the detailed examination. But I found the detailed clinical examination have been done using the OSCE. But OSCE is a simulated one. So I didn't get any real clinical procedure being done by chair side where the assessor is observing. So I found that
It's okay. You restrict yourself to DOPS.
Okay.
Yeah? You restrict yourself to DOPS. That's perfectly fine.
Okay, ma'am. Okay.
Yeah.
And yeah. Ma'am, I'll just show my whatever. Hello, ma'am. Can I continue or Dr. Siddharth will be continuing?
Okay. Who is showing this?
I don't know. I am showing this, ma'am.
Okay.
No, I think Mirna, you need to work and then you need to, because 54 DOPS and 54 mini CX doesn't make any sense.
I wrote it down, ma'am, according to one article. They have done like this.
That's what again I'm telling you. You go to the literature, but you think of your context also. You
Ma'am,
don't
can you please
copy
help
paste
me?
things.
Yeah. Can you please help me just getting one doc original form so that I can modify it?
I
I'm
will
not
share
getting
it with you. The
Okay.
checklist you mean to say?
Yes, ma'am. So that
Yeah.
I can
So
modify it.
can you remind me tomorrow with a WhatsApp message, because it's there in the college on the other computer. I will share it on the group.
Okay, ma'am.
But just
I'll remind
WhatsApp me so
in the
that I
group only,
remember.
ma'am. I'll remind you. Okay, ma'am.
Yeah, chalega. No problem. I'll do it tomorrow without fail.
Okay, ma'am. Thank you, ma'am.
Acha, Jyoti,
Yes, ma'am.
can you share?
Ma'am, actually, my video is not working,
Okay, then
and
only Arun is remaining. Arun, you can do it.
actually, I discussed with sir. Sir told lots of change is required in my presentation.
Madam, actually, what is happening that she wants to do curriculum change or developing a curriculum for dental pharmacology for PGs. And so, Ashwini ma'am, you want to say something?
Developing curriculum is a big thing, so I got a bit of.
No, I can make up. So we are discussing. So what I have suggested to Jyoti that we will again discuss. I will discuss with her and makes the things more clearer that what is her intention and what actually want to do, and accordingly we will
Is
guide.
there a need?
So,
Did she found out there is a need already?
so that all we are going to discuss, and I have suggested her that anyway, if we are going to do small thing also, then we'll be using a Delphi technique. So that all we will discuss. So initially, I think I need to discuss with her primarily her objectives, because what she's thinking and what we are doing is different. What I make out from the presentation and she shared with me. So I think after that she will present, that will be better.
Yeah, after refining, I think.
Yeah, sure.
Madam,
Yeah,
you're
Siddharth?
mute. Madam, you're mute.
Yeah, I
Jyoti, I
can't
had
hear.
told you last time that
Yes,
you are
yes,
very
ma'am.
ambitious, but let us see how it works. Last time
Yeah,
she
yes,
wanted to actually much more bigger bite she was taking. Anyway, it's
yes,
okay.
yes.
I'm very happy that you are so enthusiastic. Arun Kumar, can you present? You are the last.
Yes, ma'am. Ma'am, I am audible.
Yes.
Ma'am,
Have you
research
shown it to
project
Dr.
proposal
Gaurang?
is need analysis
Have
to.
you shown it to Dr. Gaurang?
No, ma'am, I've not discussed with him. Ma'am.
See, remember, your primary guide has to see it. Then you can discuss with co-guides. The primary guide is not available, then you discuss with co-guides. Because if we three have to be on the same page, you understand? And we'll take help of Ashwini when it's more refined. We cannot be disturbing her time now and then. Today you got a lot of input from her. So please see that
Yes, ma'am.
you are on the same page. You call up and fix up a time.
All right, ma'am. Ma'am, may I start, ma'am?
Yes.
My research project proposal is to need analysis to shorten preclinical exercise duration in first year MDS. Ma'am, rationale of this proposal is to know there is challenges in the clinical scenario, the different clinical scenario which comes in the MDS, ma'am, and the MDS graduate or postgraduate has to be capable of handling the challenges that he has to see after he complete his post graduation. We already know that in dentistry, a graduation gives him an immense clinical knowledge to handle clinical cases, and it would be not correct that he spends 6 to 12 months of his PG program spent on preclinical exercises. This reduces his optimal clinical exposure during the postgraduate period, leading to difficulty in handling difficult clinical cases subsequently. The problem or need is due to prolonged involvement of first-year MDS students in the preclinical exercises reduces the available clinical time during MDS curriculum. Contrast is the BDS students have basic preclinical and clinical exposure during graduation, therefore providing refresher exposure of preclinical exercises for limited time period or early entry into the clinics in the first MDS students. The outcome, ma'am, in a short term, it improves early learning of the student regarding clinical procedure, and also it improves the psychomotor skills of the students on the model as well. And intermediate would be improves the learning and provides additional time for the students in acquiring clinical skills, which ultimately gives a long-term effect in betterment, better treatment implied to the patients. So these are my short-term, intermediate, and long-term outcomes. Student early transition clinical phase leads to a student familiarity with the roles and responsibility of a clinician, and which ultimately leads to a well-qualified postgraduate with immense clinical exposure and expertise, which lead to develop a potential in interpretation of clinical scenario after completing his post-graduation. It also, in a short-term outcome, increase in the student's motivation and satisfaction, which develops a professional identity and boosts their confidence in handling patients. And students can also start clinical cases early, which give a sufficient time for them to understand and treat the complex cases. There are very less literatures available in the postgraduate preclinical duration reduction. However, there are some relevant literatures which are correlated to the early clinical exposure, which have been presented here. There is one clinical study which has been done on first year MDS periodontology students, wherein clinical skills or the surgical skills have been evaluated subsequently. That would be discussed later on, ma'am. The limitations and gaps would be there will be initial resistance to accept the proposal to curtail the duration of preclinical exercise in the stakeholder side. That may be the faculty and the administration. It would be challenging to the faculty to formalize the curriculum and convince the administration during the early stages of implementation of the proposal. Student competence and interest is required for the early completion of the preclinical exercises. There can be initial hiccups to decide on duration of preclinical exercises for the first MDA students. As I was mentioning, these kind of researches for the first MDA students in reduction in the clinical in the preclinical duration are less. However, there is a study to understand the early clinical exposure model on the surgical performance of first year MDA students in the subject of periodontics have been recently been done. They have concluded that retention of knowledge is better due to integration of basic science and clinical science and development of self-directed clinical learning skills. It is a better learning methodology than a traditional teaching alone. So my proposal is going to be new because such studies have not been done earlier. So if these proposal are, if this is being understood, well taken up by the stakeholders, would get sufficient time for the first year MDS students to understand the clinical process and engage into the clinical aspects earlier. And also this proposal will be a precursor to think tanks to study the ECE models in undergraduate curriculum in the dental field similar to the medical field, which is already been in process of acceptance. This is my concept map. The methodology here, my stakeholder will be the MDA students who are in the second and third year, postgraduate faculty, administrative staff. Sampling would be the sample size would be 50, which includes the Army Dental Center R&R Delhi and Dental Department FMC Pune. So the methodology will be by distributing the questionnaires, surveys to all the stakeholders, conducting the interview, focus group discussions, and also auditing the preclinical exercises and treatment audit of the second and final year students. These are my references.
Can I talk? Can I? Can't hear me? You can't hear me? Nobody's saying it.
Hello?
Yes, ma'am.
Stop
We can
sharing.
hear you, ma'am.
Stop sharing. How do you get a sample size of 50 in 2 centers?
Yeah, ma'am, you have 10 students per the PG program, ma'am.
In
It's
Prosto?
10 and
In
10.
Prosto?
No, ma'am, I'm taking as first MDS for all specialities.
All specialties don't have preclinical.
Ma'am, I've discussed with them all specialty like the ortho have some preclinical, surgery also go through, and periodontics also have. So in endodontics also they have their preclinical exercises which is spread till 6 months.
What
So
about
when I
oral
discussed with the
pathology?
stakeholders, all of them are following presently.
What about oral pathology? No, think it over. You're taking a sample where and all the students, you're asking them the input. But it
Yes,
is
ma'am.
actually the policy makers also need to answer. Because it's a good study because at least it will create an awareness among people. People are talking in this way. These are the type of studies I have seen. But you know, the question is the attitude of the mind is fixed. 6 months, nothing they should do, only this. Some colleges started later 1 year. This is because individual problem, Arun, of the private colleges not having enough patients in those days. Maybe now it's not a problem. But earlier, what will the student do? That is the question mark. Various
Okay.
things created these. And maybe you are only taking 2 may not be answer to all. That doesn't matter. But I am doubtful about you taking the 10 students of all. See, the prosthetics is the only one. Prosthodontics gives you that 1 year and 9 months and 6 months. Rest of them don't give you that long. Whereas we in government colleges don't give them any time at all. We give them only 1 month or 1 week because we have so many patients who will treat. So we put them on the clinic from the day one. We tell only 7 or 8 days, you have to come on the clinic. How can I give them the time? So there is a variation in the place to place. That is not the question. The question of variation, in general, most people follow 6 months.
Yes,
You
ma'am.
can easily make it to 6 weeks. I have seen everywhere abroad also, they make it 6 weeks, including Eastmen and all. They send them 1 week posting to endo. They send them 1 week posting sometimes to other department other than prosthodontics. And they ask, basically, it is the policy that we had to understand that they have come here to treat the patient, the pre-clinic. They are not come here to make any laboratory work or any other this thing. That basically. So you have to create an awareness with questionnaire for both the maybe the students won't know whether they require, what will they answer? It will be a biased study if you ask a just entered first MDS student.
I'm
Think
not
about it.
including them in the study, ma'am. First MDS students are not included. The second and third year students are included, ma'am.
Yeah, I saw that in your presentation. I saw that. Okay, but anybody, any input, Ashwini? Taking faculty from all the faculty, students from all the departments, their variations.
No, I think you should stick to Prosto.
All right, ma'am.
But how many students?
I'm not very sure. But no, you can stick to Prosto, but increase more than 2 colleges. See, what are you trying to do here? You are trying to create awareness and trying to change something, the practice which is going on probably for years. Now, if you want to convince with your study results the higher ups that the preclinical needs to be reduced from 6 months to 2 months, whatever is your result, you need to have substantial evidence, and that evidence can only be gathered if your sample size is huge.
All right.
Not the students alone, the faculty. Why?
Yes.
Faculty questionnaire may be like slightly different. I mean,
Okay,
what is the reason for what? I mean, do they find the students to be better off and as a better practitioner in the end? And you need to conduct a focus group.
In fact, now I don't know whether it's feasible or not, but faculty is one. You may not have those many numbers, But what you can definitely target is prosthodontics in your area.
I can do that, ma'am.
Because they would remember that during their MDS, their first 6 months were kind of not needed for that preclinical thing.
And I will remember that I had no time at all. I just entered the clinic. So there is, you have to see, Arun, either you
Yes, ma'am.
create it in the north, because now you are in the northern India, or
Yes,
maybe
ma'am.
a region of 4 or 5 states, or across whatever you want to do. Because this problem must be solved. I agree. If there is an awareness of answering that itself, see, exams are the best way to learn. So this it's a thought process people will start, whether it is required or not. But it has to be faculty and the students. And if you're sticking to ortho and endo, perio, you need to tell me, inform me as to how long they have and what are the techniques they have. Maybe in oral surgery, they may be giving suturing. That is required. Perio
Yes, ma'am.
also incision and other things and all. Here they
Yes,
are
ma'am.
doing some work which is unmotivated. Right?
Is
Ma'am,
there any is there any document? Sorry, go ahead, Arun.
Ma'am, endo, ortho, and prosthodontics definitely spend 6 months, but surgery and perio are just a variation because they are being pulled out into their the OTs and the other surgical assistants, so they have a earlier exposure. Whereas endo being told to make the inlay onlay patterns and then casting them post and core on the models before they enter into the clinical setups. Similarly, the orthodontics, they will make them do all the preclinical works of wire bending, then cephalometric analysis, and then drawings, and then they have been allowed to enter into
We
the
picked
things.
it up from ortho only. Ortho are the masters. Even during our time, the ortho people never allowed them to touch the patient for at least 4 to 6 months.
Yes, ma'am.
We picked it up from ortho. And there are multiple local problems. I still feel like Ashwini, what she said, stick to prostho.
All right, ma'am. I'll do that, ma'am.
Number of colleges more. It will
Yes, ma'am.
become pan India may be difficult. So you take north. Last year, people have done one study in maxillofacial. She did only northern part, and that too was Delhi and around colleges, NCR, whatever you call it. I don't remember. So that was excellent. She involved about 6 or 7 colleges, and all in the NCRT region or whatever you call it, you know. So in your case, it can be, and people cooperate and answer also.
Ma'am, if you permit, ma'am, I can request my colleagues in the forum also to give their feedback, because all are prosthodontics. I can circulate the questionnaire and I can
not only circulate to them, you can ask them to take it up to their colleges. And now the question comes, when you're giving the question to the stakeholders, how do they get the ethics permission? So you have to get ethics permission and give them, so that their ethics committee just says, okay, one ethics committee has done something like that.
All right, ma'am.
Yeah, I'll put you through the person who did, so that you can discuss with her also. And
Okay,
because I had told her to do it at least with 7 or 8 postgraduate. Everybody doesn't have post-graduation. Everybody doesn't have maxillofacial taught in their colleges. So we created a curriculum for them. So in that case, we required at least few colleges. Think about it. Yeah. See, you want to create an awareness. I'm not saying overnight DCI or NDC is going to listen to us. But at least there are people who will think, it is unnecessary. Okay?
All right, ma'am.
Yeah. And you give me a good reason why we should include ortho and this thing, and will they cooperate with us? That is one more thing.
Yes, ma'am.
Ortho, they say it is very essential.
That's the reason I'm telling you, you stick to your specialty.
Prostho.
Okay, ma'am. I'll take that point.
And you involve more prosthodontics.
Yes,
rather than, that's how you can also go for practicing prosto if it's possible for you. Because
okay, ma'am.
If that's they, I mean, they would also be able to comment whether in practice, those are the 6 months required in preclinical or just 6 weeks or 4, whatever is enough. No, my question is your dental council. I'm not aware, so I'm asking for MDS prostho curriculum. Is there a curriculum first of all?
Yes.
So is there anything mentioned about the preclinical posting and the
Preclinical work
duration?
is mentioned, but the time is not mentioned.
Duration is not mentioned, ma'am.
So it's been decided just like that.
Yes, ma'am.
Okay. So you can put it in your give reference of the dental council curriculum, and then you can put it in your introduction that
Yes.
it is varying all throughout the India, as madam said. In Nair, it may be for a week or 2 weeks because there are a lot of patients. They need to rope in everybody. But in
Now with the we
otherwise,
getting students across India, some of them have not had enough
not
exposure, so that we also give them about a month's time, but not more than month and a half. You can't sit just like that, doing nothing. Yeah.
Ma'am,
So I
standard
think-
among the various colleges is being 6 months plus. So accepting few colleges.
So we have completed for today. I think we can log out. And Tuesday, I think we continue with the curriculum and other things and all, because and we need to decide a date wherein there will be 5 presentations by other people who are not done. If you are not shown to your guides, you are not going to present over here. There are lots of issues. Okay. So anything, Chinmay, you want to say? Gaurang, you want to say? Ashwini, you want to say?
No, I think whatever feedback received, even today, so I request that again, I think those who are with me, we will again discuss, and you can ask any question. You feel that this is not clear, please clarify each and everything. Don't feel that this is a small question. Because see, what happened is medical education and education research is totally different than our routine research. And secondly, sometimes we get confused with our research and our educational methodology. So please don't hesitate to ask any question to any of the guide. Okay, and you will differ sometime. What I say, sometime it may be possible that Ashwini ma'am will say something different. Nagda madam will say something different. So clarify with us that sorry, you are telling this, Nagda madam is telling this, and Ashwini madam is telling this. So what to do? Because see, the perspective may be different. So my humble request is please clarify. So don't get confused and don't get decided.
And it is
We all
better
are
to get the
mature enough.
perspective from everybody. And
Ma'am,
ultimately,
can I request mentors to please share their mail ID so that we won't disturb them, or should we discuss with them in the WhatsApp?
you have to discuss.
Discuss in the WhatsApp.
You
and
can
require
discuss on my
call.
WhatsApp, personal WhatsApp also. And secondly, any project can be made educational or subject wise, depending on what is your question. Remember, we were telling, I think Meenakshi, that some questions are look like as if subject questions. That, her whole motto is to teach the students the nutritional aspect and not make a nutritionist. At the same time, a clinic should have a prosthodontist who is having the complete umbrella of patient care. So she is right in that. In that, however, is it an educational project is, we are finding out what is the need, how it can be imbibed into the students, how it can be included in the teaching program in the clinic, and ultimately the long purpose, she said, it will improve the patient health and this also.
And one more thing is, don't think that we always want to do big thing. We will start with the small thing. So don't get disheartened also, because we have passed through the same phase. When we have submitted our project for female fellowship, even today also, when I am doing IFI, I submit something big, and ultimately I end up doing 10% of what I have thought before submitting my projects. So even don't think that we will do big and then only it is considered as a project. See, you are a agent of change. So whatever small change you will be able to make, ultimately it will give you happiness, and other will get happy. Okay, you have done this, now I will do. So you will be torch bearer for others. So whatever small we can do, we will do it correctly, perfectly, and tangible.
See, I wanted to create an entire geriatric curriculum for the BDS students. Remember that. So my mentor told me, think about creating first a need assessment and then create. It took a long time for me. It took 2 years because we had a 2-year, 3-year course like that. It took more than 2 years for me to do something at the level 1, short-term outcome. You understand? So always it will be reduced, tapered, what is possible for a bite for you to take. That's what we do with the thesis also. Right? Can we call it a day?
Yes, ma'am.
Yeah.
Thank you, ma'am.
Chalo,
Bye.
bye-bye. Good
Good
night.
night.
Good
Bye.
night, everybody.
Bye.
Bye-bye.
Good night, ma'am. Good night, everyone.
Good night.